Now, school children in England can ditch their masks from tomorrow, but new evidence shows COVID cases remain high in under 18s. Well, there's also confirmation of what many people have reported. A previous infection doesn't seem to protect you from Omicron. Well, our health correspondent Catherine Jones joins me now. And Catherine, things not really progressing the way we thought they would be.
Well, I think we were all hoping, weren't we, that Omicron would go up really sharply and then fall really sharply. Now, today, figures from the Office for National Statistics do suggest that in Wales and Scotland, the virus is still in retreat this week or last week. But in England, that progress seems to have stalled, and it appears to be because of outbreaks in schools. So let me show you some of the figures for people testing positive in England, measured by the REACT study. Among adults under 55, the Omicron wave has peaked. The pattern is similar for over 55s too, actually. But look now at the prevalence among school-age children. It was already higher, and it's still heading up. Now, already 415,000 children in English schools were off last week because of COVID. This looks like that figure may still rise, and that's led to renewed calls from teachers' leaders for the government to really focus in on ventilation in schools.
They thought we were through it with the Alpha variant, then they thought we were through it with the Delta variant, and then so they didn't do the preparation. They could have got this ventilation in place before the Omicron wave. There would now be far less disruption in our schools, but they should be doing it now.
And Catherine, what more have we learned about whether you can catch COVID twice?
Well, the same study found that among people who caught Omicron this month, 2/3 of them, a huge proportion, reported they had had COVID previously. Now, they didn't say how long before, so there's a chance that that figure does capture some people who had perhaps, had the same infection and tested positive for the same infection. But even so, I think it's a fair assumption to say this is showing that Omicron is so different from previous types of COVID that it doesn't offer, the previous types don't offer you much protection against the new infection. What is also telling is that if you had got COVID this month, you were 10 times more likely to have had it before. It is the same people being hit again. Key workers, people in deprived areas, ethnic minorities. So although Omicron may be milder, it is zeroing in on the same types of people.